Oh.
Okay. Good
Okay.
morning. So it's me and Prema. It's been a rough morning. So hopefully you guys are able to see this. So we're just going to kind of start from Prema's part and just assume that we're segueing from Dr. SSB's influenza part to Prema. So.
Okay, hey you guys. So, disease surveillance in a digital age. I'm on that slide. So, as Dr. Bourgeois has previously mentioned, disease surveillance plays an important role in monitoring the spread of disease to establish patterns of progression over time, as well as understanding what type of factors may contribute to such circumstances. Disease surveillance is achieved by using two of the methods that was already mentioned, which are ILI and laboratory testing. These two methods require patients to check in with the doctor to be tested for the symptoms. However, what if there was another alternative? What if patients wouldn't have to rely on waiting for their doctor's checkup to figure out whether they harbor flu-like or influenza-like symptoms? What if we can use the rising power of technology to our advantage in terms of conducting disease surveillance?
Next slide.
Okay, so influence of technology on disease surveillance. So today, our ability to control epidemic outbreaks has been
Keep going. I'm going to shut that door.
has been facilitated not only by advances in modern science, but also by the worldwide spread of new technology such as computers and smartphones, which allows more than 2 billion people worldwide to have access to the internet, according to the CDC. This represents as an opportunity to collect and communicate health-related information in real time, including those who lack access to healthcare. If we use the rising power of technology to our advantage, then it will have multiple benefits, such as convenience and flexibility. Because when we meet with healthcare professionals, we have to meet them on their own time and availability. But having it online makes it accessible for people, and they can do it in the convenience of their own time, whenever and wherever. Accessibility by anyone who owns a touchscreen phone, such as an iPhone, Android, or even an iPad or a regular computer. Again, it takes into account of those who are uninsured and or live in rural areas with lack of transportation to healthcare vicinities. Many individuals lack access to healthcare, so if they possess symptoms of a disease, they are more likely to be a threat to the well-being of others in a population. So it's very important to have those uninsured to have the knowledge and resources to be aware. It has also changed the health professionals. It has also changed the way health professionals are able to track disease incidence in a population over time. If health officials are able to detect trends of a disease before it transforms into an outbreak, then they'll be able to respond faster to the incoming threat before it becomes a hazard to others in the population. And when tracking for disease incidence, health professionals are also able to track for risk factors that the individuals may be exposed to. This helps them to understand the type of precautions they must take to prevent outbreak, and it also is able to provide information that would have been unavailable through traditional surveillance systems, such as having real-time data. Lastly, but not least, it increases the effectiveness of vaccines. Once health professionals are able to detect the type of risk factors based on the symptom data, then they'll be able to create a vaccine that will work to either provide temporary or permanent immunity from the supposed threat.
Next slide.
Okay, so this is a visual representation of the percentage of mobile phone users between 2010 and 2016. Now, as you can see, the usage of mobile phone users has increased by 25% between 2015 and 2016, further showing if health information is supplied through the online, then millions of people will have access to the information.
Next slide.
This is an example of how health information via online can play a massive role in promoting the well-being of individuals, would be the swine flu pandemic. Kind of messed that up anyway. In 2009, Twitter caused an uproar amongst this billion number of followers with the breaking news how there has been an outbreak of swine flu and how people must take precautions against it. Due to the massive number of people that follow Twitter, this caused significant amount of awareness as well as panic amongst the general population. According to CNN, Twitter played a major role in bringing attention to the swine flu pandemic before the news channel were able to cover it. This is another visual, excuse me.
So next slide, it's the half of smartphone users page.
This is another visual representation that breaks down what individuals use their phone mostly for, from highest to lowest percentage in a descending order. On the top is showing that approximately 62% use their smartphone to get information about health conditions. This is an important statistic to consider because this further shows that that health information and communication through online is transforming the way individuals gain the knowledge they need to promote their well-being, or that people have an interest to access health information using their smartphone. So now the question is how that health information is being tailored to the user, and what are the ways that surveillance can be utilized in this instance. One instance would be to use participatory surveillance.
Next slide.
Okay. So, what, oh God. Okay. So, what is participatory surveillance? Well, it is when participatory surveillance systems crowdsource voluntarily submitted symptom data from the public and can aggregate and communicate that data in the near real time. And crowdsourcing is an open call for anybody to participate in a task online where the crowd refers to an undefined group of people who participate. Again, this is a great option to use for disease surveillance via smartphone or computer online that would require, that can allow individuals to access their health information and also help public health officials to get the health information they need to see if there are any trends of outbreak. Okay, next slide. In order to accomplish the vision of FNY, we would have to have participatory surveillance. Instead of traditional public health surveillance, traditional public health surveillance is very time-consuming and very expensive, but participatory surveillance costs less, takes less time, and increases the population awareness. Although many established systems have the benefits of specificity and credibility, participatory systems offer advantages in the area of speed, sensitivity, and scalability.
So now that Prema has elaborated a little bit more on participatory surveillance, we can now move on to what is Flu Near You. That is kind of the point of our presentation today. And Flu Near You is this form of crowdsourcing. So what is Flu Near You? Going on to the next slide. Flu Near You is a free participatory surveillance system for tracking symptoms of the influenza-like illness through a mobile app or website in the United States. The Flu Near You program works to get participants to self-report their symptoms. And what the vision of Flu Near You is to promote and protect the well-being of individuals and their communities by engaging them in disease surveillance. This allows individuals to report their symptoms in real time, and it can complement traditional tracking as well while providing useful information to the public. So their whole initiative is to get the community involved, provide this information, and make people aware that what's going around their community as well as around the United States as well. This app and mobile website also provides resources and guidance how they can protect themselves from the influenza virus and how they can take steps to help those around them as well, which is very important. So next slide. So to kind of elaborate more on how it works, it's a weekly self-reporting. You get either through the app, you get a push notification, or you get a weekly email reminder. And usually this is on Mondays, and they send you a little survey that you fill out. It takes a few seconds. It's free and it's anonymous. Thousands of reporters across the country also contribute weekly, so it's sent out to all of the United States and Canada as well. Reports are collected and mapped so that you can know what the flu around you. So this is what the weekly survey looks like. They give you at most 3 questions. You submit. This information is not, your personal information is not shared out, just your information that you submit if you're having those symptoms or not. It is important to know that reporting no symptoms is just as important as reporting symptoms, because we also need to know who is doing well and who isn't getting the flu. After you submit that survey, then you're able to share it across media outlets, either such as Facebook or Twitter. But again, that is your option. You do not have to. So after that, you're able to, the app or the website will bring up a map where you're actually able to see around the United States and around your community who has reported how symptoms of the flu are doing that during that time. So this is next slide. This is the map that would pop up in news. You'll see it'll show around who is reporting symptoms, red being people who are experiencing symptoms of influenza. And then you'll also be able to see how many people are reporting in your state and just percentages of people having some symptoms, no symptoms to severe symptoms. So then next you will see a report card. The report card plays a crucial role because this is what will be submitting in the contest, and we'll elaborate more about that a little bit later. This is what your report card will look like. You'll be able to see how your participation rate is doing, how many weeks you've reported, how many eligible weeks you were also able to report. Again, this is going to be important for the contest later, which I will elaborate on. And lastly, it'll provide other resources for you. And those other resources will be flu news. There will be a link where you can get up-to-date information on how influenza is around the United States or any big news that is going on. And also, you have a portal where you can find out where you can get the flu vaccine. It also brings up phone numbers, addresses, hours on there. Well, so it's really crucial because if anyone around you is, I don't want to get the flu shot, I don't know where I could go, you can simply pull this up and you're able to get some information. So next slide. So how do you join? You can join either at a computer at flunearyou.org. Once you pull up that webpage, you'll be able to see a little icon that says join here. Once you do, this little thing will come up. You'll enter your first name, last name, gender, zip code. Again, we do not share your information, and we do not ask you too many questions of personal information. It's just kind of to be able to map you on the map, just general information. And then this is how you would join on an iPad or mobile device. Again, you would go to the App Store on your Apple or iPhone product, or Google Play on your Android device. And again, you want to look for the blue flu icon, and you'll just download it that way. And you can also join there. Next slide. Just want to kind of show you what Flu Near You looks on various devices. So right here is the computer version, what it would look like. At the very top, you'll see the flu map, the news, press, and facts. So computer version obviously can give you a lot more information on Flu Near You. Then this is the iPad version. The image on the right is kind of your home page. This is where you can see your flu map, again, your vaccine finder, your flu news, and then you'll see your report card is where you find in your settings. This is what the Android version looks like, very similar to the iPhone version. We just wanted to be able to show you both of those. So now to move on to an important part, the Flu Near You contest. So the contest is going to be the duration between February 1st and April 15th. The school with the most amount of entries of what is qualified to be participation in Flu Near You. Entries must either have been recording before February 1st, or new participants have a minimum of 4 reports and at least 75% participation rate. So if you are just signing up February 1st, you need to at least be reporting 4 weeks with a 75% participation rate to be qualified as being eligible for the contest. Anyone can participate in the contest. Their points will be assigned to one of 4 schools of public health. So again, you are encouraged to get as many people as you want to sign up, because again, they don't have to be public health or even Dillard affiliated. It's just you can get your grandma, your mother, your sister. They will just, at the end of the contest, they'll be given a survey and they'll be able to assign points to that school of their choice. That survey that you will submit at the end will be open from April 11th to 15th. Again, we will be in contact with your SGA, whom we will let you know and send that survey out to you. The winning SPH SGA receives a $3,000 cash prize with the caveat that the school students will be able to vote on the use of this. And here is a screenshot of the survey, what it kind of looks at. And again, we will send this out to you and you will be notified of when to submit this. But again, you do have to get a screenshot of your actual report card to qualify for this. If you don't fill out this survey, then you won't be entered into the contest. Some references, and does anybody have questions?